How we treat a pinched nerve in the low back depends on how much pain or how much neurological dysfunction the patient has. If the patient has tried physical therapy, has tried epidural steroid injections, and they still have pain or a neurological problem, then we have to do surgery on the patient. And the type of surgery we do depends on what's causing the pinched nerve. Sometimes a microdiscectomy can be used, and this is used generally for herniated discs that cause the pinched nerve. Sometimes we have to do a larger procedure, which is a laminotomy or a laminectomy and medial joint facetectomy, where we shave off a portion of the facet joint to open up the spinal canal. If the patient has a significant amount of degenerative disc changes, along with a herniated disc, with chronic low back pain history and a pinched nerve, then interbody fusion may be necessary to treat this patient.